All right, let's get right into it. Think about the most critical pipeline in your entire body, the one that absolutely everything depends on. Now, what if I told you there's a way to fix it from the inside, right before it fails? Well, that's exactly what we're going to break down today.
It's a really scary thought, isn't it? And this isn't just some hypothetical question. For thousands of people every single year, their body's main pipeline, we're talking about the aorta, it develops this dangerous weakness. And the worst part? There are often zero symptoms until it's way, way too late.
So the medical name for this condition is a thoracic aortic aneurysm, and the analogy on the screen is perfect. Just imagine your aorta is this high-pressure hose pumping a massive amount of blood 24/7. When a weak spot starts to bulge out, the risk of a total catastrophic rupture becomes incredibly real.
Okay, so first up, let's get a real handle on the scale of this problem. Why is this condition so critical to catch and to manage?
The numbers really do speak for themselves. This isn't some rare, obscure condition. Thoracic aortic disease is a major killer, responsible for over 11,000 deaths in the U.S. alone every year. And the danger? It pretty much all boils down to one single factor: size. So here's where the story starts. If that bulge, that aneurysm, is pretty small, let's say under 4 centimeters, the risk of it bursting over a 5-year period is practically zero. At this stage, doctors are comfortable just keeping an eye on it. It's what they call watchful waiting. But check out what happens as it gets bigger. As soon as it hits that 4 to 6 centimeter range, the 5-year risk just skyrockets. We're talking up to a 31% chance of rupture. This is the zone where doctors stop watching and start making a plan to intervene.
And this is the real tipping point. Once an aneurysm grows beyond 6 centimeters, the risk changes. It's not a 5-year risk anymore, it's an annual one. Over 15% every single year. At this point, that aneurysm is a ticking time bomb, and intervention is no longer a choice, it's an absolute necessity.
So imagine you're a patient with one of these big, dangerous aneurysms. You're facing a massive decision. For a long, long time, there was really only one option, and it was a huge, invasive surgery. But today, there's another way.
You've basically got two paths, and they are worlds apart. On one side, you have traditional open surgery. We're talking a massive incision, cracking open the chest, a long recovery. On the other side is TEVAR. That stands for Thoracic Endovascular Aortic Repair. It's minimally invasive, done through a tiny cut in the groin, but, and this is a big but, it comes with a serious, lifelong commitment.
So, how on earth does this minimally invasive fix actually work? I mean, how do you repair the body's biggest, most important artery through a tiny little incision?
The really ingenious thing about TEVAR is that you don't actually remove the damaged part of the aorta at all. Instead, the idea is to build a new pipeline inside the old one. This inside-out fix basically reroutes all the blood flow away from that weak bulging wall.
The procedure itself is just a marvel of modern precision. First, it starts with incredibly detailed planning using 3D scans of the patient's body. Then they make a small incision in the groin to get access to an artery. From there, a collapse device, it's called a stent graft, is carefully snaked all the way up to the aneurysm. Then it's deployed, it just pops open. And finally, it seals itself against the healthy parts of the aorta, creating that brand new safe channel for the blood to flow through.
Now, for any of this to work, for that seal to be perfect, the surgeon needs something that is absolutely critical. They call it a landing zone. Basically, it's a stretch of healthy aorta at least 2 centimeters long, both before and after the aneurysm. This healthy tissue is what the graft anchors onto. Without a good landing zone, the procedure just isn't an option.
Okay, so this all sounds pretty amazing, right? But like any medical procedure, you've always got to weigh the pros and the cons. You've got to balance the risks and the rewards. So let's take a look at the actual data and see what TEVAR's track record really looks like.
And wow, this chart tells a really powerful story. This is probably the single most compelling argument for TEVAR. Just look at the difference in the risk of dying within 30 days of the procedure. For TEVAR, it was about 2%. For open surgery, over 4 times higher at 8.5%. That immediate survival benefit is just a massive factor.
And it's not just about surviving the operation. The benefits just keep stacking up. Patients who get TEVAR tend to have fewer major complications with their heart and lungs, they lose way less blood, and they get to go home from the hospital much, much sooner. It's just a less traumatic event for the whole body.
But, and this is a really big but, it is not a risk-free procedure.
it has its own unique set of potential problems. The most common one is something called an endo leak, which is where the seal isn't quite perfect, and some blood leaks back into the old aneurysm sac. And because you're working with instruments up near the brain's blood supply, there's a risk of stroke. And probably the scariest one, there is a small but very real risk of cutting off blood flow to the spinal cord, which can cause paralysis.
So all of this brings us to a final and absolutely crucial point. Getting a TEVAR graft placed isn't the end of the road. In a lot of ways, it's actually the beginning of a whole new chapter in a patient's health journey.
This is so important to understand. TEVAR is a treatment, not a cure. That device is now a permanent part of your body, and it has to be monitored for the rest of your life to make sure it's still working perfectly and no new problems have popped up.
And this isn't just a suggestion. This follow-up schedule is non-negotiable. You get a CT scan at 1 month post-op, another one at the 1-year mark, and then you're getting scans every single year for life. This surveillance is what guarantees the long-term success and safety of the whole procedure.
You know, the experts themselves, the Society for Vascular Surgery, they put it perfectly. They say that all the excitement and enthusiasm we have for TEVAR has to be tempered by this lifelong obligation of surveillance. It's a deal. It's a pact between the patient and their doctor.
Which leaves us with a really fascinating question to think about. I mean, we've seen this technology evolve so quickly, with smaller, better, more durable devices coming out all the time. So you have to wonder, are we watching the beginning of the end for one of the biggest, most intimidating operations in all of surgery?
It's pretty incredible to think about.